Welcome into Fountain Report Insights. I'm Matt Bubala here with the latest news and information from the Fountain Report and the team at Intelligence. In this Friday's Fountain Report, Dr. Natalie Marks has a piece titled Designing the Visit Before the Patient Arrives. She joins us now to dig a little deeper. Dr. Marks, you lay out in the article how practices can gain a lot of efficiency by using tools available to be well prepared for what kind of visit and what might be needed before the patient is in the exam room. But I have to ask, getting information out of clients can be tricky, especially when so many are shy about revealing everything. So what is the best way to get them to give staff all the details you really need to walk confidently into that exam room?
So Matt, you bring up a really good point, which is how do we get the most accurate histories from our clients so that our visits can be as comprehensive and efficient as possible, and we can be proactive in setting up that hospital for success. So a couple things I want to make sure that we're thinking about. One is that the medical record for one of our patients, and of course that client, that family, cannot be static. What do I mean by that? Is that I think in a lot of hospitals, we take that history moment as something that is predominantly the veterinary technician or nurse's role and or the veterinarian supplementing that depending on how your workflow is. But I want to encourage hospitals to think about every single person in that hospital having a role in contributing to that medical record, putting in the emotional health of that patient, putting in different signs that are given to them during scheduling the appointment, whether that's over the phone, which is less and less, or online scheduling. So everybody adds to that medical record for completeness because we're going to have different interactions and different comfort levels with that client depending on the role in the hospital. Second thing I want you to think about, and I know everyone hates these three letters, SOP, but thinking about having templates and standard operating procedures about what we send out to a client to gain information back. So as an example, if a client schedules an appointment for check itch, we should have a template that we send to that client to gain more information before that exam so that we know exactly where to sort of dive off from when that patient and client is with us in person. That also helps us prep of what we're going to need for a dermatologic workup in that exam so we can have our equipment ready and primed, again, to spend the most time actually with the patient and working on diagnostic and treatment plans versus redundancy of history taking. The third thing that I want to suggest to us, for all of us, as a good reminder, is to think about the demographics of your hospital and how do we meet our clients where they are at. What do I mean by that is most of our younger generation of pet parents, millennial and younger, they don't want to talk on the phone. So if we're trying to get that information given to us over a standard phone call, think again. How can we text this to them? How can we email? How can we converse through an app? Whatever way you have in your workflow, so it makes that client as comfortable as possible sharing information.
You can read Dr. Marks' full article in this Friday's Fountain Report. Our most recent Fountain Report conversation features our managing editor, Chris Kelly, speaking to Dan Eisenstadt of Terramed Real Estate Solutions, talking about how real estate ownership plays into overall practice ownership value.
What keeps me up at night is deferred maintenance. You know, the sector developed as mom and pop veterinarians were building in converted houses and sometimes not with institutional buildings. And then when you had investors come in and buy the practice and the landlord would be remote, if they didn't take care of it, there would be little things that if the doctor who owned it was there, they would take care of. A leak here, a leak there. There's just a lot of deferred maintenance in a lot of the smaller general practices, and that keeps me up at night in terms of sort of the quality of the building stock that we've got.
Check out the full interview and see all of our Fountain Report conversations by visiting our Intelligence YouTube channel. And make sure to hit that subscribe button. And you can subscribe to the Fountain Report by visiting intelligence.com. Follow us on LinkedIn to always have access to the latest news. For Fountain Report Insights, I'm Matt Bubala. Make it a great week.